Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. We're at the HIMSS 2022 conference and we're with Troy Ament. He's Healthcare Field CISO at Fortinet. Welcome, Troy.
Yeah, thanks for having me, John.
Yeah, so tell us a little bit about yourself and Fortinet.
Yeah, so I'm Troy Ament. I'm the Field CISO at Fortinet. I joined Fortinet after just over 20 years in healthcare and leading EMR implementations, and then the last 10 years of my career as the CISO for two of the largest US health systems.
Wow, that's a good background. So give us an idea, if you're a CIO today and you want to share 3 important security efforts that every healthcare organization should be doing now, what would you suggest?
Yeah, I think the things that we're seeing that are creating a lot of momentum are things around zero trust. And zero trust as a framework are things like multi-factor authentication, network segmentation, but then also for those organizations that are getting more secure within their security program, things like security operations. So standing up a security operations infusion center and getting really ahead of ransomware attacks and just the evolving threats and the threat landscape. And then the last thing specific to healthcare is really a medical device security program, right? Partnering with both medical device manufacturers and embedding security, but then improving security inside of a health system as well.
Talk about that security center. What do you think would go into that?
Yeah, so I've built a couple security operations centers, my former organizations, and they really start out with baby steps, right? It's all about getting good visibility and a coordinated effort to secure an organization. And that can be things like building playbooks, automated threat response, getting visibility and standing up threat hunters in an organization so they can look at what the adversaries are doing and then proactively implementing long-term or short-term strategies to protect that organization.
Yeah, that's great. So what's an area of security that maybe not enough healthcare leaders or CISOs are talking about?
Yeah, I think the connected medical space, and there's a lot of different strategies around protecting connected medical devices. One of those strategies that we're seeing a lot of momentum is us partnering with medical device manufacturers. And what we're doing is embedding our security there. In some scenarios that's post FDA approval, and then in some scenarios that's us working with them, pre-FDA approval to really embed that security into those devices. We're also seeing a lot of health systems getting better visibility into their environments so they know what connected medical devices are on their network. The strategy around that, though, is really around evolving threats. So if you look at the evolving threats, whether it's a new zero-day vulnerability that exists in the market, is really being able to very quickly understand which devices within your environment need to be remediated, whether that's protections, maybe that's being turned off or patched. And that's kind of the first step, being able to find those devices, then developing the plan and what it takes to remediate.
Interesting. You talk about medical devices. Do you think consumer health devices are there, or is that still not a massive threat to healthcare organizations?
Well, yeah, definitely anything that touches the patient is connected is something that we need to be concerned about. And that can be devices that are always connected, or maybe they're just connected when they need to be serviced, because that's obviously a point where they could be infected as well. I would say that we're talking about things like, vitals machines, CT machines, that type of thing. Those are the things that are being focused on right now. But I can tell you that, some of the wearable type devices, whether that's just something that's, tracking your health, or if it's something that's actually being intravenous in your healthcare as well.
Yeah, for sure. And that's going to evolve in a big way, I think. What are some of the top 2 or 3 threats that you're watching for in 2022?
Well, in 2021, it was really the year of ransomware. And ransomware really started back in 2014. If you look at the evolving threats and where ransomware and the bad actors really got funded well was going back to 2014, and that's because they were able to monetize the threat. They're making money, so they're getting better funding from their support groups. So I think we see ransomware continuing to be in the very early stages of maturity and continuing to grow. Last year there was 186% year-over-year growth of ransomware compared to 2020. So we continue to see that grow. But the other area that we saw the most significance back in 2021 was really the impact to operations. So, as a CISO in the past, an executive in healthcare, we would see downtimes and impacts of maybe 4 to 6 hours once a year or something like that. Now these threats and operational impacts, we're seeing health systems with 3 to 4 months of downtime, which really wreaks havoc from a revenue, brand, and patient impact and safety perspective.
Yeah. That's crazy. So it's interesting you talk about the financial of the hacker or whoever's doing it, right? But how about from a CISO perspective? I know they sometimes have challenges getting buy-in for security efforts. Any suggestions there?
Yeah, it depends upon the space that you're in, but I think you're always protecting your revenue. You're always focusing on patient care. And I think embedding security into your governance models for an organization is really important. And then making it a differentiator for your organization. If you're a health system looking to grow and do mergers by acquisitions, you certainly need to show strength in that space, because if you're not able to protect an organization as they are now, it's even much more difficult to protect them as you grow, because your threat landscape is significantly growing.
Yeah, absolutely.
So you've got to be able to protect your organization, foundationally, and then grow as well. And then I think the other area is your brand. It's a significant challenge and threat to organizations. They grow these brands, they build these brands, and to have something negative in the news is never a good thing.
It can be a problem for a lot of brands, so that's true. Where can people go to learn more about Fortinet?
Yeah, so Fortinet.com/healthcare is one spot, but then also here at HIMSS in booth 1369 is a great place to come visit with us.
Awesome. Thanks so much, Troy, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application.